Welcome back to The Pulse with Peter B. Peter Biancamano. I'm your host, as you know, because the show's named after me. But anyway, we are here at the offices of Hudson River Care and Counseling, located at 310 Cedar Lane in Teaneck, New Jersey, and of course, 63A 8th Street in Hoboken, New Jersey, where our home base is. And we're joined by two special guests who might look familiar from the commercials that we air, but they have never been on a segment, so they're making their Pulse premieres. And to my right, I have Rachel Frank, and to my left, I have Rebecca Ennis-Paez. Did I get that correct?
Yes,
I
you did.
love that, absolutely. And you know, it's always better when I say that on camera, just in case I do mess it up. You know, a different story for a different time. Anyway, ladies, how are you today? We'll start with Rachel.
Doing great. Hi.
Yeah, absolutely.
Well, thank you for thank you for having us.
Exactly. Of course. Thank you for having me. I mean, I said this in a previous segment. I'm going to start paying rent up here, I feel like. Beginning with Rebecca, what do you do here at HRCC?
I am the office manager here, so I take care of the insurance and billing and client relations.
Wow.
So I handle any positive reactions and negative reactions. Plus, I handle all the billing for insurance.
The most thankless job right here, let me tell you. I mean, it really, really is. But certainly the most important. I mean, I know I love my admin staff over at my full-time and my office managerial staff. I think they do just a yeoman's work. And I feel like it's the complaint department.
Yes, but I will be working under another supervisor, but starting September 5th, I am also going to be an MSW student here as well.
Oh, congratulations.
Thank you.
Great.
So,
absolutely.
I know it's finally starting.
Yeah. Rachel?
Hi, everybody. My name is Rachel, and I am a clinical social work intern here at Hudson River Care and Counseling. And so I see clients. I work with kids and adults, but my passion is play therapy. So I am a mother, and I love incorporating doing play therapy with clients.
Well, that's phenomenal. And people who, just to go off of what you said, Rachel, who have watched our show before, which I hope is still many of you, but we've been in a different location here in the offices of HRCC. We are almost in a children's room here. Of course, my gompy tall body's blocking the play area behind me, but we decided to come into this room specifically for our guests today, since they do a lot of the work with children. So I was wondering, Rachel, starting with you, if you can possibly give some examples, without obviously going into confidential information, or of children you work for, since it is back to school month this month. So
yeah, so back to school month is very stressful for families. It's not only stressful for our kids as they're transitioning sometimes to a different school, new teachers, new peers, new friends, but it's also obviously very stressful for parents. All of the shopping, the stress of getting all the school supplies and clothing, and just getting into a new routine. So, one of the things I always tell everyone is, especially as parents, is to talk to your kids about the fact of validating their emotions and their experiences during this time. It's very hard to transition, as kids often transition sometimes to a new school. If they have bad experiences, they have negative experiences, that's their school. They have to adjust to it. And as adults, sometimes, if we don't like our workplace, we can switch. And so it's things to be aware of, and just be very, have a lot of empathy for your children as they transition, and empathy for yourself as you're adjusting to the new routine.
yeah, and Rebecca, I'm sure, as really the person who oversees every, aspect of HRCC, you really see a diverse amount of people coming in. And do you see the numbers increase in September and October with families coming in because of the back to school stress?
Well, during the pandemic in general, we really saw a lot of children in distress, and it was heartbreaking. We saw it in young children too, who had a lot of stress and anxiety during the pandemic, and then going back to school. And it's hard to say, is it from them directly, or is it from the parents? Probably a little bit of both. The parents were putting, because going back to school, the parents' anxiety heightened because of fear of them getting sick. So that transferred that to the child. So we have seen a lot of that. And as I'm actually a mom myself, and I know the anxiety of sending my child to daycare so young. So I get it. So when I'm doing intakes and talking to these patients, that's one of my jobs, not to do therapy with them because I'm an admin, but certainly to just reassure them that we will get family counseling for them or individual counseling for their children.
Unbelievable. And Rachel, I'm sure in the primary examples that you mentioned, it's not just a back to school type of, where the numbers rise in terms of people getting, seeking help. I mean, it is all throughout the school year because, bullying. I mean, I was on the Board of Education in Hoboken for 6 years, and I know when we had HIB reports, and on those harassment, intimidation, and bullying reports, some of the things that were said to children, I can't imagine, what the child and their families must be going through. So Hudson River Care and Counseling is here for any type of examples like I just mentioned, correct?
Oh, yes. We've had a lot of clients with different needs, from bullying, a lot of kids with anxiety. I've worked with a lot of teenagers with a lot of challenges from the transition of COVID, as well as bullying issues and coming into their own. And we have seen a rise in young people seeking counseling services across the board, as well as adults coming in and realizing they've never come to therapy before, but that they really need it after the isolation of COVID. And yeah,
it's sad, and it affects the whole family because I mean I'm in my mid-30s, and anything that any way I get emotional, my mother is definitely feeling it as well. And Rebecca, it's just as a person who again oversees the day-to-day operations here. I mean, after the pandemic, because we've had Dr. Pam on before, and she says that, and Yudi, and the numbers have spiked after the pandemic. Do you actually see some resolve in the future, or do you think people will continue to try to get the help they need?
I think we're forever changed, and I don't really honestly see the numbers going down. I think they slightly plateaued a little bit. But we normally, summer in general is normally very quiet months, but we really haven't, maybe very slightly have leveled off, but the numbers are still very high because people have so much anxiety about going to work, travel, school, all across the board. And
that's so important. And Rachel, because the numbers being high is a good thing, folks, because these people are seeking help. Right. Am I right or wrong?
Oh, yes. And I would say even nowadays our society has become more aware of the importance of mental health, and more people are coming to therapy that would never seek therapy in the past. We have found, recently there was a established 988 suicide hotline, national suicide hotline. And that kind of makes us aware as counselors how important the need is for mental health services, that it should be as common as calling 911, that people that need help, that need mental health help, we are here, and we are here in person and virtual for those that have busy schedules. So there's no reason not to get the mental health services you need.
Yeah, for all ages.
Yeah.
Exactly. And you can come right here to Hudson River Care and Counseling. I mentioned the 2 addresses, but of course they do telemedicine. Visit their website. Rebecca, you want to say the website?
Yes, it's www.hudsonrivercareandcounseling.com.
Perfect, yes. And Rachel, if they ever are in need of your services, they can do so right on the website as well. Correct?
Exactly. You can contact us and we'll get in touch
Should
with you.
we share the number as well?
Yeah, absolutely.
We have, you can call us in both Spanish, English, and Korean at 201-541-8600.
Wow. That's excellent. Well, Rebecca and Rachel, thank you so much. I really appreciate you. I mean, you know, the society's lucky to have people like the people here at Hudson River Care and Counseling, in my opinion. They're there for you. Reach out to them. Thanks again, ladies. Really appreciate it. All right, folks, we will be right back.